In this video, we're going to cover 9 of my favorite exercises that really work well for people dealing with sciatica or leg pain from something like a disc bulge. I'm Sebastian from Performance Place Sports Care in Costa Mesa, California, part of the locally world-famous chiropractors. And before you start these exercises, just know there's one thing that you should be considerate of is we call it centralization and peripheralization. If you notice doing these exercises that your pain starts to travel down from your buttocks area, down to your leg, down to your calf, down into your foot, and it starts residing more away from your spine, these exercises are not right for you. We call that peripheralization. Centralization is another thing you may experience where when you're doing them, you start to feel your problem of any type of symptom, pain, tightness, numbness, tingling, and so on, start to work itself away from your foot, away from your calf, away from your knee, all the way up, and it may reside into the area where your SI joint or low back is. That's actually a good scenario. In order to fully get rid of something like sciatica from a disc herniation, you need to work itself out like a thermometer. And this is a very hard thing sometimes for people to comprehend, because sometimes when it starts to come back towards the spine, it starts to intensify and become painful in a way they've never experienced before. It's not that it happens every time, but uncommonly that does happen, but that means progress. Obviously, these exercises have not been curated specifically to your problem. If you want to work with us directly, check out our contact information. It'll pop up on the screen somewhere, and we can work with you directly and find exercises that actually work well for you. If you have a current medical condition, you should always be seen by a medical provider first. All right, now we're going to cover my 9 favorite exercises for sciatica directly related to disc bulges. This is Sarah.
Hello.
She's going to help us out with this. Go ahead and lay face down on your belly, and then we'll start out. Now, I want you guys to go back to this video often and daily. We're going to have a countdown timer that pops up into the corner, which is going to help you guys keep pace. Go ahead and lay your hands onto your forehead, or forehead on the hands. And so all I want you to do is just breathe into my fingers, or for you guys at home, you may feel the bed or the floor. Ideally do this in the bed. All you're focusing on doing is breathing with your belly into the bed. Everything else is nice and relaxed. For some of you, you might have to actually turn your feet in a little bit, but this should feel like a comfortable position. Next, we're going to crawl up onto your elbows as if you're reading a book at the beach. This is called our prone prop position, and she's just going to hang out here, relax the back as much as you can, and just breathe into the bed again. Okay? How do you feel in this position, Sarah?
I feel very relaxed.
Relaxed position, real easy, right?
Mm-hmm.
Now, some of you might not be able to get into this position. That's okay. Just do the version that you can, and even having the elbows a little bit forward sometimes is helpful for people. Now, we're going to get into the next one, which is a press-up. Can you show me a press-up?
Sure.
Good. And come on down. And just do those reps for me. Now, you're going to notice that some of you can't actually do this range that Sarah can. That's okay. Sarah, show me one with the lower range that a lot of times people will do,
So
right?
Here.
And it feels like a lot of tricep work, right?
Yes, for sure.
So it just feels like the triceps are on fire. You want to ideally be almost paralyzed from this point down, and you use your arms to press, press, press.
Shaking already.
Shaking.
Mm-hmm.
All right, go ahead and pause on the ground there. So now she's going to take just a little mini break here because people's arms get tired. Nice. You chose right. So she's going to take a prone prop type of break. Breathing into the bed. When she feels ready and you got juice back in your arms again, can you show me those press-ups again?
Yep. I'm ready.
Whenever people do this, sometimes they have the first 10 reps is a little bit stiff, okay? That's okay as long as it's just stiffness, it's not pain. If it becomes too intense, obviously don't do this. We talked about centralization and peripheralization earlier. This is nothing you want to go down the leg. It should just feel like it's stiffening the back a little bit, but you're working through the stiffness, all right? Sometimes people are able to overcome this stiffness by taking more breaks, but Sarah's got a lot of juice in the arm, so she's gonna keep going, right?
Now I'm done.
Now she's taking a little break. So just take breaks when you need to. And we're going to do this for roughly about 30 seconds times 3. And the next one we're going to go to is called drop downs. Go ahead and come up on hands and knees. Good. Show me a drop down. Good. Come back up. Now, A drop down is really nice because it's a way to expose your body to that same extension pattern that was really helpful to her in the first place, but not necessarily tanking the arms, because people's arms get really tired doing that. So where the drop downs is a really easy alternative. What we're gonna do though is we're gonna do 2 more sets of this, taking breaks whenever you need, or 2 more sets of roughly 30 seconds. If you wanna take a break to your elbows during the 30 seconds, that's okay. When your arms feel ready or your body feels ready, go back and go to it again. Good.
Much better on the triceps.
Easier on the triceps, right?
Yeah.
And a lot of times people's backs will be a lot looser doing it this way, when I feel like sometimes their body's fighting, like their low back is fighting to extend. Now, an important note when you do this as well is don't go any further than you actually can. I know that Sarah's doing it just how she's doing it now, but you don't need to do it how she's doing it. You don't have to do the range that she's doing. You just have to do the range that you can do. So we're gonna start milking some of that stiffness out of your back, which is the most important part here. Give me 1 more rep at that. Okay, now we're gonna move into the bird dog. Can you show me a bird dog setup here?
Yep.
Nice. All right, show me it first, and then we'll tinker with position.
Sure.
Great, looks good. Getting long and long. Show me 1 more. Good. Now, in order to find a position that's best for your back, go ahead and push me up, and then lower me down, and then find the middle. That's an area that feels generally pretty good for you.
Right about
Good.
here.
Show me the bird dog again.
Okay.
And make sure that you're keeping my hand in that position the whole time.
Okay.
We're gonna go for longer hold times. Good, and return. Probably no more than 10 seconds, keeping moving the whole time. We wanna make sure to get this done in a short amount of time as possible. Nobody really wants to do these all day. Okay. Good, keep going there. Put some pressure in my fingers a little bit. Go ahead and keep going. Now, sometimes putting pressure into the fingers can create some pain for people. We're not asking you to bear down like you're trying to hold your breath. You're just trying to push your guts out into the finger just a little bit. And that should be helpful to create a nice decompressive force on the spine, which helps out with the disc and sciatica and so on. Good. Where do you feel all this stuff so far, Sarah?
I definitely feel my core and my glutes.
Core and glutes. Good. So that's the good spots. So if you start feeling your back, you're going to want to tinker with that position first again. Next one, we're going to go on your side. Can you go show me a side bridge?
Sure.
Okay. And show them the movement of the side bridge.
Okay.
Nice. And go
Thanks.
again. So what we're doing in this is she's trying to create a straight line from the knee to the hip to the shoulder at the top. Good. Back down and go again. Between reps, she's sitting back towards me. Good. And keep going on this. We're going to do this for a full minute. You can take mini breaks at the bottom if you'd like, 5 seconds or so. I wouldn't take much longer than that. And back up again. Good. Try to push your hips towards me and come on back. And push your hips towards me and then sit back. Push your hip towards me and sit back. Now we're going to start to change to the other side. Good. Same exercise. Go ahead and push your hips towards me and then sit back. Where do you feel this working, Sarah?
I definitely feel the underside of my core.
Good.
Here.
Underside of core, that's a good spot. Sometimes people feel it on the bottom side of the glute, on the bottom here, and that's a good spot too. If you start feeling it in your back or it starts to feel like it's irritating things or going down your leg, this may not be the right thing for you at this point in time. But as we go through the next set of it, or the next 30 seconds of it, we can change the cueing just a little bit to see if it changes things. On the next one, when you come up, don't try to get up, just try to push my finger to the floor.
Okay.
Good. So her primary goal is to push my finger down through the floor, not to get up. And sometimes what that does is it helps out to link up the musculature better, so you're not using certain sections of the spine, which will create irritation of the disc and the nerve as well.
Oh yeah.
Nice. Now the next one, go ahead and flip to the other side.
Okay.
We're gonna do, this is another version of a side bridge. This one we're gonna go knee up and right in there in that position. Good. Your only goal is to reach far and then push my knee towards the floor and come back up again. And go again. Now Sarah's doing okay with this, but I want you guys to take a little bit of a note that she has a little bit of twisting happening here. Go ahead and come on back. Good, place your hand right there. See if you get your, imagine there's a flashlight here. Can you roll the flashlight towards everybody? Perfect. Yep. And then push my finger through the bed. Mm-hmm. And go ahead and roll back again. And come on back. Good. And roll again. We're gonna roll your body. Push really hard into the floor. And come on back. You're gonna roll your body. Push into the floor. Good, and come on back. And let's try the other side now, okay?
There's a lot of glute on that one.
A lot of glute?
Yep.
Yeah. Good. Reach, roll the body, push into the floor. Which glute do you feel on, if you felt it on this one?
I feel my left one.
This side, the downside, right?
The downside.
Good. Go ahead and reach. So that's the perfect spot for it. If you start feeling it in your low back or your leg, a lot of times what people are doing is they're rotating about here like we talked about. In that case, hand on the hip, pressure into the fingers. Roll as far as you can and then push down. Good, we got about another 30 seconds of this. Roll, reach, and push. And return, good. Roll, reach, push. Reach a little higher for me this time. Like you're trying to reach for the alarm clock's really way up there, but you don't want to get out of bed to turn it off. Good, and return. Oh, I can tell you're shaking on this one.
I am.
Good, roll, reach, push, last one. And then we're going to go face down and do a version of a plank. Go ahead. We're going to do, this is called an elbow knee plank. And so she started on her elbows and knees. I want you to imagine I'm going to try to push like a book underneath your body. Can you just give me room for that book under your belly?
Sure.
Good. And come on back down. And go again. And so she's giving me room right here for my hand to slide underneath her body. And come on back down. And go again. For some of you, you won't be able to hold this top position too long. That's okay. But for some of you, this might be too easy. In that case, move your hands out a little bit. Good. Make room for that book. And come on down. Where do you feel this working?
Much harder. All my core.
On the core, on the front of your body?
Yep.
Perfect. Then push me up again. Under no circumstances should you feel your back during this one. If you do, then you're going to regress the exercise, okay? Or just continue. All right, the last one is a quad rock. Go ahead and show me this. Nice. So she's just sitting down into a nice deep sitting position, or as far as her back can tolerate. If she starts to feel back pain here, come on out. If you start to feel leg pain here, come on out. So she's never really going into the range that is stretching or feeling like it's becoming the problem. She's just exploring a little bit of range and keeping the hips greased up and really mobile, if you will. Now she's going to do this for another 30 seconds or so. Give me a little bit of pressure here, just a little bit. Good, and come on out again. Now, if you guys have liked this so far, obviously thumbs up this video and make sure you bookmark it so you can watch more of it to come. We do have a webinar as well. It's going to pop up in the corner, which is a little bit more detail about low back pain and sciatica that you guys really should watch. We'll cover some of it following this video, but we go way into more detail so you can understand what's going on in that next video. Good. Go ahead and take a break.
Okay.
So these are the 9 exercises I like the best. If you don't have success with them, there are ways to coach it differently, as you kind of saw today. Sarah was doing a little bit of twisting and rolling, and so we changed the coaching cue. So a lot of the exercises can be helpful, but also how you do them is very important. So you may need to be coached on some of them moving forward, but at this point, try this every day. Come back to the video, let us count down for you. Now, if you want to learn more about why sciatica happens, especially related to disc bulges, we're going to go into a little anatomy lesson and mechanics of the body so you can learn more about it. We're going to do it immediately following these exercises, so stick around right here. Before we start with the anatomy lesson for sciatica, know that sciatica is actually not a diagnosis, it's a symptom. I'll say it again. It's not a diagnosis, it is a symptom. It does not describe the reason why you're having the leg pain. All sciatica means is leg pain. Let me reiterate that in simple terms. Imagine your car doesn't start. Well, that is a symptom. But the diagnosis could be it's out of gasoline, the battery doesn't work, or the starter's broken. Leg pain or sciatica can come from many different diagnoses. The ones that we mainly see creating sciatica are low back disc bulges, foraminal stenosis, and piriformis syndrome. The exercises we picked to show in this video is mainly about sciatica relating to low back disc bulges. For your specific problem, it's always a good idea to be evaluated by someone who knows what they're doing, one person from part of your medical team. This can be a medical doctor, orthopedic surgeon, it can be a sports chiropractor, a physical therapist, or even a physiotherapist. This person will perform a series of movement tests, orthopedic examination, and neurological testing to figure out exactly why you're having what you're having. Imaging is not always required. If you're interested in working with us at Performance Place Sports Care, we do have online sessions available. We have in-persons as well as online programs. Now, as we go into the anatomy lesson about sciatica, it's important to see the structures first and know what they are. That way we know how they work. Now, this is the whole spine here. The section we're mainly going to pay attention to are the red section down into here. This is the lumbar spine. The areas in red are the vertebral bodies. These are bones within your spine. And then we have the translucent region, which is the disc, the intervertebral disc. Then we have the nerve roots in yellow. The intervertebral disc is really nice because it makes it so the spine can actually move. It's an amazing structure. The spine is actually amazing when you consider what it can do. It can become very stiff, but also it can be very flexible. And this is what you're going to want. You're going to want properties of both. Having a functional disc helps you to bend at that segment. If you look right here, this segment, if we bend it too much, it could possibly break or damage. However, to produce movement like side bends, you would move certain sections incrementally to produce the side bend. Having movement in each section of the spine with the disc in the middle of two vertebral bodies allows the spine to flex. Regarding sciatica, the areas that we care most about are these two areas down here, these vertebral bodies, as well as the disc underneath them. The sciatic nerve is created by multiple nerve roots. These two are some of them, as well as other ones that come out below them. Now, in order to get a better look, we're going to take the smaller model here. This is the back side of the spine, and this is the front side of the spine. We're going to take a deep look into the spine to see how it actually moves and how the disc can affect something like a spinal nerve. Now, as I mentioned before, the intervertebral disc is a really important structure because it allows movement of the spine. It allows it to move in extension and rounding your back and leaning to the side and leaning to the side. Without it, you literally would be a rod. You wouldn't be able to move. So it's a very much needed structure. However, if you require too much movement out of one of the segments, and then because you have the other ones above and below, sometimes the area starts to degrade and fatigue. And what we're looking at from a lumbar disc bulge is if we look at it from the top here, this is actually a translucent vertebral body or bone that they allowed us to see deep into the disc to understand what's going on inside it. Now, if you look down into there, you're going to see in the center, there is a jelly material. It's kind of clear. And then the outside area are these rings. The rings I like to consider kind of like yarn. Imagine tightly woven yarn in different directions, like a ball of yarn. The center part, normally people call this the jelly of the jelly donut, which would be the disc. However, it's a little bit more like a tar substance. But with models like this, a lot of times they represent a little bit more gelatinous material that move very fast for the sake of showing things. Now, a disc bulge, what it could do is as you start to move the material of the jelly tar back to the back of the spine, right into here, it may create pressure on a nerve root as it exits the spine. The nerve roots come out of these little holes in here. So there's the disc, there's the body, there's the hole. You can see me on the other side of it probably. You might see the blue of my shirt in there. You see the blue of my shirt coming straight through right there? Okay, and this is the nerve coming out of it. So if the bulge comes into this area, creates less space, it essentially creates pressure on the nerve, which creates leg pain or sciatica. The sciatic nerve innervates different parts of the leg, different ones from different nerves above and below it on the spine. It mainly innervates areas below the knee and on the back side of the leg, the gluteal region, the back of the hamstring or the back of the thigh, the calf musculature, and then the bottom and some parts of the top of the foot. This totally explains why certain areas become tight and painful and uncomfortable when people are dealing with sciatica. Or when they have non-textbook sciatica, a lot of times they'll feel tightness of the leg. They won't feel numbness, tingling, stabbing, shooting, or electricity. They'll feel tightness of the hamstring, or they feel tightness of the calf, or they'll feel pain in the foot. Any area where the nerves that are going through the sciatic nerve touch onto, technically it can become symptomatic in some form. They can be burning, shooting, stabbing, aching, or numbness, tingling, and so on. Understanding the physiology changes, what happens to the nerve, is the next step. We learned that number one, if the nerve has compression on it, it creates physiological changes. It physically changes. What happens when the physiology changes is that the nerve becomes sensitive. Essentially what happens is we're occluding pressure onto the vein. Let's just say my arm is the vein. You occlude it and you create pressure, and this creates swelling. Imagine my arm larger or swollen. At this point, it becomes intolerant of certain activities like compression. If I have compression here on my nerve, pressure down here downward into the hamstring or the calf or the foot may become very uncomfortable. That's why things like deep tissue work and pressure on the area may become painful too. Also, it won't be tolerant to stretching. Stretching a nerve that has physiological changes such as swelling can create pain. And that's why things like stretching your hamstring or your calf a lot of times will increase your symptoms, even though momentarily it may pause them for a couple moments. With a good recovery program, you're going to want mainly three things, but the first thing that comes is going to be decompressing the nerve. This doesn't have to be done surgically. Oftentimes it works very well to do it in a movement-based setting, in a therapeutic or rehabilitation setting. Removing compression of the nerve restores some of the physiology, which decreases sensitivity to things like stretching it and sliding it. However, a lot of people, especially when they've had the problem for a very long time, their nerve or their nervous system adapts, meaning you have to restore those movements like sliding and tension. And that can be done with a series of exercises if you go to the right person to prescribe them for you. Now that you know the basics of how a bulge of a disc can create things like nerve pain, let's cover two common situations of how this actually happens for you. Situation one is rounding the spine or flexing it with some compression of gravity over time. The second scenario is rounding it, compressing it with something like a weight, and then rotating it. And these are the mechanics of two types of disc injuries. Situation one is the most common. It involves excessive, chronic, poor posture. A lot of people will think that the most common type of disc bulge is going to be from trauma or lifting. It's not. Actually, the area is oftentimes compromised or fatigued with chronically poor posture. This is how this works, and I'll show it on the model again. We have the front side of the spine here, and we have the back side. And then we have, remember, that jelly substance in the middle. As I start to push on the front side here, really hard over time, it starts to work that jelly material backwards, and eventually it can create compression on the nerve. And again, this jelly material, just imagine it like that jelly donut. If I push on the front side here, it'll work its way back towards the back side. This doesn't happen over the course of a day. In fact, it happens over the course of a few months oftentimes, or even a couple years. And as the back wall starts to become fatigued from holding that gelatinous material at bay, the jelly will start to work its way through the yarn and eventually work its way to the outer part of the wall where there's actually nerves right there. Now, this explains why a lot of people will actually have pain where I didn't do anything. I woke up with it. I just bent over to pick up a pencil and all of a sudden my back went out and my leg went numb. Scenario one, people will oftentimes have more pain with prolonged sitting and prolonged standing, but generally walking makes them feel better, and standing up from a chair, although in the very beginning it might not feel good, after about a few steps it starts to work itself out. Some people will call the phenomena of getting up out of a chair and then feeling tight and then starting to walk a result of the hip flexors being shortened and overworked. I would say this is probably incorrect. It's actually the material working itself back towards the center again, and after a few steps it starts to work its way back away from the wall. Many times putting on your shoes, getting out of cars, in the first few hours of the morning are actually pretty painful, while through the afternoon times, a lot of times, these scenario one people will oftentimes feel generally pretty normal until the morning again, when it comes back, or they have to go on a long plane flight or a long car ride, or they work excessively in a seated position. Many times, these people will feel tightness of the hip flexor, tightness of the hamstring, tightness of the calf, which will lead you to believe that you have to stretch them. But honestly, if you start to get the right program to recover the disc and reduce the sciatica nerve pressure, a lot of this stuff goes away on its own as well. Scenario two people are those ones that you may consider as the common ones. but they're not. They're usually lifting a heavy weight, they're deadlifting or squatting or doing something at the gym, and their back pops. They have leg pain, or they just have back pain, or eventually it starts to travel itself down the leg. It doesn't happen all the time at one time. Sometimes they feel the pop and they start to notice things tighten up and come up over the next couple hours or the next day. And then they have about a 2-3 day period of time where they feel pretty bad. Some of these people are stuck on the floor for a period of time, can't get out of bed. Eventually when they start walking, walking makes them feel better. But oftentimes there's not a lot of positions that will make them feel comfortable at all. Rolling in bed will be very uncomfortable. Coughing and sneezing will increase the leg pain a lot of times. Bending forward certainly will. Extending backwards feels uncomfortable. Sitting too long, standing too long, walking too long, all these can be very painful. However, things do get better, at least you should know that, and eventually things will settle down, and there is a series of exercises you can use for that scenario as well. Regardless of which situation you fall into, and there are subcategories by the way, there's generally one thing in common. Rounding your back does not feel good. Extending or walking feels a little bit better, if not perfect, but rounding your body and things like picking up objects, putting on your shoes, getting out of cars, and things of that nature oftentimes are very painful because they have one thing in common. Your back is rounding. And we call this a flexion intolerant sciatica at Performance Place. Both scenarios are very treatable with rehabilitative medicine, movement exercise, if you will, stretching and so on, but it usually takes particular exercises. It's not throwing everything at it, generally won't work very well. The good news is that you can get better and it doesn't require surgery, medication, or injections of any type. Generally speaking, the sooner you address this, the better. The body goes through a series of adaptation and changes. Just as if you had a tack in your foot for a year, you would limp for a year and certain muscles would grow and certain muscles would shrink. And a lot of times movement patterns will become deeper ingrained, or movement habits will become more deeply ingrained and they're harder to break. So even though you may have had this for a longer period of time, just know there is a way to solve this for you as well. It just takes a little bit more work and a little bit more dedication. However, the sooner you address it, the better it can be. Common adaptations the body will go through over time when you're dealing with sciatica from disc herniations are that the glutes will become very dormant, the hip flexors will get very tight, and the hamstrings will get very tight. Also, other sections of the back will start to pick up the workload to limit how much your low back starts to round to spare your nerve from the insult. As we mentioned before, you want all the sections of your spine to move well so it becomes flexible. You want to get that flexibility and movement back, or else sometimes people have subsequent problems that come from excessive movements of areas above the initial injury. They can create things like groin pain, flank or lower abdominal pain, sometimes upper glute pain, piriformis tightness, hamstring tightness, and sometimes inner knee pain. If you like this video, please subscribe and give it a like. This video, as well as many of the other ones, we try to provide really good information at Performance Place on the YouTube channel. But if you really want help from us directly, we can supply that. We have video sessions where you can work with us one-on-one, just like so, but more that we're actually communicating to you. And we also have things in person too. We have in-person sessions where we do good, thorough evaluations, figure out what's going on with you. We can figure out what's safe for you to do now, and also what we need to add to make it so this area doesn't progress and create problems over your lifetime. If you want to get back to full activity, we're the place to come. Contact us. All of our contacts are in the description below, and we'll see you next video.